All right. Continuing with Unit 21, excretion, we'll look at Part E and Part F. Let's look at Part E, other urinary structures and function. Let's look at the ureters. These are the tubes connecting the kidney with the urinary bladder. It's lined by transitional epithelium. Urine is transported by peristalsis. You'll hear more about this when we get to the digestive system. The ureters enter the urinary bladder at a slant. So as the bladder fills, the pressure tends to close off the entrance. It's not a through valve, but it does close it so urine won't back up into the ureters and kidney. The urinary bladder is lined also by transitional epithelium. You remember this epithelium can change shape as the organ is stretched from cuboidal to squamous. The muscular wall is composed of smooth muscle called the detrusor muscle. The exit is guarded by the internal urethral sphincter, which is also composed of smooth muscle. It's involuntary. The openings of the two ureters and the urethra form a triangular region in the bladder called the trigone. It's a common site of bladder infection. The urethra is short in females, but longer in males, and divided into a prostatic and spongy urethra. The external urethral sphincter is located at the distal end of the urethra in females, or the end of the prostatic urethra in males. It's composed of skeletal muscle, which is voluntary. The micturition reflex is the reflex to urinate. The parasympathetic nervous system contracts the urinary bladder and relaxes the internal urethral sphincter. The sympathetic nervous system has the opposite effect. When the bladder fills, sensory nerve impulses are sent to a center in the lower part of the spinal cord, down in segments S2 and S3, called the micturition center. Motor impulses from the micturition center then stimulate the muscle of the bladder, the detrusor muscle, to contract. It also relaxes the internal urethral sphincter. Voluntary control involves motor impulses from the cerebral cortex that control or contract the detrusor muscle and relax the internal urethral sphincter. They also relax the external urethral sphincter. Let's begin with part F, acid-base balance. We'll briefly review acids and bases. You've probably seen this before in the molecules chapter. We'll look at the maintenance of normal pH, and then we'll briefly look at acid-base abnormalities. A review of acids and bases. An acid is anything that releases hydrogen ions. For example, hydrochloric acid ionizes into hydrogen ions plus chloride ions. Bicarbonate or carbonic acid ionizes into hydrogen ions and bicarbonate ions. The strength of acids vary. A strong acid, for example, hydrochloric acid, produces almost totally hydrogen ions and chloride ions. 1 part molecule to 20 million parts of the ions when at equilibrium. A weak acid, for example, carbonic acid, produces fewer hydrogen ions, 1 part molecule to 20 parts ions when in equilibrium. That amounts to 1 million parts molecule to 20 million parts ions. Compare it with a strong acid. So you see it's 1,000 times, 1,000,000 times weaker than hydrochloric acid. A base, on the other hand, accepts hydrogen ions. For example, sodium hydroxide. It ionizes into sodium ions and hydroxide ions. The hydroxide ions then accept hydrogen ions to form water. In both cases, in the acid case, the solution ends up with more free hydrogen ions floating around. And in the beaker with the base, the solution ends up with fewer hydrogen ions floating around. The quantity of hydrogen ions, or the concentration, is measured with what's called the pH scale. 7 is neutral. Any number less than 7 indicates greater hydrogen ion concentration, but lower pH. Whereas if you increase the pH, that refers to fewer hydrogen ions. The pH of blood varies around a very narrow range. Arterial blood has a pH of around 7.4. Venous blood has a pH of about 7.35. Now notice both of those are on the basic or alkaline side of neutrality. Acidosis occurs when the pH is less than 7.35. Now again, that's still in the basic range, but because it's less than normal, that is, more hydrogen ions than normal blood, it's considered acidosis. Severe acidosis results if it's less than 7.3. Alkalosis, on the other hand, is anything greater than 7.45. Severe alkalosis greater than 7.6. pH has a tendency to decrease. That is, the hydrogen ion concentration tends to increase. This is due to a number of factors. Metabolism of substances containing phosphorus and sulfur, such as nucleic acids, amino acids. These result in an increase in inorganic acids, including phosphoric acid, sulfuric acid. Also, the production of organic acids tends to decrease pH. Lactic acid that is produced during anaerobic metabolism. Fatty acids produced whenever fat metabolism increases. Carbon dioxide generation from cell metabolism to form carbonic acid is another source of ions to decrease the pH. Normal pH is maintained in 3 ways: buffers, respiratory control, and renal control. Let's look at buffers. A buffer is anything that decreases the effect of something else. For example, let's look at characteristics. They decrease the pH changes, but buffers don't prevent pH changes. They can act rapidly, just in a fraction of a second, as quickly as chemical reactions can occur. They do not, however, prevent hydrogen from entering the blood or the body fluids, or remove excess hydrogen from the blood and body fluids. Examples of buffers include the carbonic acid bicarbonate system. In many ways, this is the most useful. We'll come back to it shortly. Phosphates, plasma proteins. These are the most common buffers. Intracellular proteins provide 3/4 of the buffering capacity in the body. Buffers involve an equilibrium state of reversible reactions. The reaction will shift one way to add hydrogen ions and the other way to remove hydrogen ions. The requirements of a buffer system include a weak acid or base, such as carbonic acid, and the salt of a weak acid or base, such as sodium bicarbonate. The most useful such buffer system, because it's controllable, is the carbonic acid bicarbonate system. Remember, carbon dioxide mixes with water to form carbonic acid, which then ionizes into hydrogen ions and bicarbonate ions. The bicarbonate ions will combine with sodium to form the salt, sodium bicarbonate, but for our purposes we can disregard this. If an increase in hydrogen ions occurs, the reaction shifts to the left. If a decrease in hydrogen ions occurs, the reaction shifts to the right. Now, that may not be quite intuitive, so for a moment, let's forget chemistry and look at this diagram. Let's simplify the reaction to carbon dioxide and water forming hydrogen ions and bicarbonate ions. Note that the written equation has a left and right side. Now, a reaction does not have a left and a right side because we're dealing with millions, billions of molecules and ions in solution. This reaction occurs in body fluids. CO2 plus water forms hydrogen ions and bicarbonate ions. If hydrogen is added to the fluid to lower the pH, the equilibrium is upset. Which way will the reaction shift to restore the equilibrium? Left. If hydrogen is removed from the fluid to raise the pH, the equilibrium is upset. Which way now will the reaction shift to restore the equilibrium? To the right. So, a buffer tends to maintain stable hydrogen ion concentrations, that is, a stable pH. If carbon dioxide is added or removed from the fluid, equilibrium again is upset, and the reaction will shift to restore the equilibrium. Now let's look at the double tank. It's filled with water. There's a connector between the left and the right side. Initially, the water levels are the same on both sides. The tank is in equilibrium. If you add water to the left side, it threatens to raise the water level to the dashed line. But water immediately flows through the connector from the left to the right to establish a new equilibrium. Now the water levels are the same on both sides. It's not exactly the height it was to begin with, but close. If you remove water from the right side, the same thing happens. There will be a shift to the right to restore the equilibrium. On the other hand, if water is added to the right side of the container, which way will water flow? It will flow to the left to reach a new equilibrium. Know about respiratory control. Here is a view on the left, the alveolus, and the tissue cells on the right. You've seen this diagram before. An increase in organic and inorganic acids will increase the hydrogen ion concentration, and due to the shift, it will increase the concentration of carbonic acid. The buffers tend to shift the reaction to water and carbon dioxide, and the carbon dioxide then is exhaled. It works within 1 to 15 minutes. It does not excrete hydrogen ions from the body, but it does restore the hydrogen concentration near normal. What about renal control? Well, here's a view of part of a nephron. That top part is the Bowman's capsule, and the rest of it consists of the tubules. Normally, hydrogen ions are secreted into the tubules, and bicarbonate ions are filtered into the tubules. They combine once they reach the tubules to form carbonic acid, which ionizes or splits into CO2 and water. The CO2 and the water are reabsorbed, and when they're reabsorbed, they combine to form carbonic acid, which then ionizes into the two ions, and the cycle continues. If the pH drops, that is, there's an increase in hydrogen ions, the excess hydrogen ions that are secreted into the tubule don't have any bicarbonate ions to react with. So they're excreted from the body. If the pH rises, that is, there's a decrease in hydrogen ions in the body, now it's as though there's an excess of bicarbonate ions. So the bicarbonate ions that are filtered into the tubules don't find any hydrogen to bind to, and the extra bicarbonate ions are excreted. This functions within a few hours. Perhaps it takes a day or two. But it's a very powerful controller of acid base because it can excrete hydrogen ions from the body. Renal control, however, is more complex than I'm leading you to believe. It requires tubular buffers. They function to remove or neutralize hydrogen ions to maintain the concentration gradients suitable for secretion of hydrogen. Buffers include sodium phosphate and ammonia. What about acid-base abnormalities? Well, one is respiratory acidosis and another is respiratory alkalosis. These are due to respiratory abnormalities. Metabolic acidosis and alkalosis are due to abnormalities other than respiratory. Buffers normally prevent an abnormality because they work fast and continuously. If buffers fail to correct the abnormality, respiratory or metabolic compensation will attempt to restore the abnormality to normal. A respiratory abnormality is compensated for by the urinary system, since the respiratory system is not functioning properly. A metabolic abnormality, on the other hand, is compensated for by the respiratory system, because respiratory control is fast. General abnormalities result from changes in neuron function. Let's look at acidosis. It depresses the nervous system, leading to weakness, confusion, disorientation, coma, rapid breathing if it's a non-respiratory cause. The mechanism, it affects the neuron resting potential and graded potential. If excess hydrogen ions are produced, excess hydrogen ions diffuse into the cell from high to low concentration. Intracellular buffers cannot handle the excess, and the additional potassium ions then diffuse out. Remember, positive ions repel positive ions, and this maintains a stable concentration of positive ions inside the cell. When the potassium ions diffuse out, the resting potential drops, a hyperpolarization, which decreases the chances of generating a nerve impulse. Potassium concentrations in extracellular fluid increase. This would be hyperkalemia. What about alkalosis? Alkalosis tends to excite the nervous system. It leads to muscle spasms, hypertonicity, tetany, convulsions, decreased respiratory rate, unconsciousness, and perhaps more serious consequences. Again, the mechanism affects the neuron resting potential and graded potential. The hydrogen concentration rises, hydrogen diffuses out of the cell from high to low concentration. Intracellular buffers cannot handle the deficiency. Additional potassium ions then diffuse in to maintain the stable positive ion concentration inside the cell. When that happens, the resting potential rises. It increases the chances of generating a nerve impulse. Now you can see the resting potential has risen, a depolarization, because as you add positive ions to the inside of the neuron, it becomes less and less negative. Potassium concentration in extracellular fluid decreases. It's called hypokalemia. Respiratory acidosis is due to a decrease in removal of carbon dioxide. So the carbon dioxide levels build up, the reaction shifts to the right, and an increase in hydrogen ion concentration occurs. Causes include impaired carbon dioxide diffusion. Remember, it diffuses from cells to blood and then from blood to the alveoli and out. Emphysema might be a cause. Pneumonia is another one. And COPD. Inadequate expiration might be due to chest trauma, thoracic surgery, blocked airways. Depressed respiratory rate and depth could also result. Sedatives or narcotic overdose could cause this. Central nervous system disorders and improper ventilator adjustment. Compensation for respiratory acidosis is renal. Renal excretes the excess hydrogen ions. Tubular buffers such as phosphate ions and ammonia counter further secretion of hydrogen ions. Respiratory alkalosis is due to increased carbon dioxide removal, shifting the reaction to the left and decreasing the hydrogen ion concentration. Causes include hyperventilation, decreased oxygen. Remember, if the oxygen levels drop, that is a secondary control of increasing respiration. Fever, anxiety, and early salicylate, that is aspirin intoxication. Central nervous system trauma might cause this, and pain. Compensation is renal. Excess bicarbonate is excreted, shifting the reaction to the right and increasing the hydrogen ion concentration. Metabolic acidosis would be due to an increase in hydrogen ion concentration. Causes would include processes that increase the hydrogen ion production, such as decreased carbohydrate intake, shifting the metabolism to increase fat metabolism. Diabetes would be one. Fasting, starvation. Increased fat metabolism produces fatty acids. Renal failure. Diarrhea, which causes loss of the alkaline lower GI tract contents, leaving an excess of the upper GI tract, which is rich in hydrogen ions. Ingestion of some poisons, such as methyl alcohol, ethylene glycol, and salicylates. Decreased oxygen intake might be a cause. It leads to anaerobic metabolism, which produces lactic acid. This might be due to cardiac arrest, vessel blockage, anemia. Compensation is respiratory. Hyperventilation to get rid of the excess carbon dioxide, shifts the equilibrium to the left, and decreases the hydrogen ion concentration. Metabolic alkalosis is due to an increase in hydrogen ion concentration. Causes include vomiting, which gets rid of the acid upper contents of the GI tract, leaving an excess of the alkaline lower content. Nasogastric suction, which might do the same thing. Increased antacid use. Diuretic therapy. Compensation is respiratory. Hypoventilation to increase carbon dioxide equilibrium, shifts it to the right, and excess hydrogen ions then increase. And that's a look at the urinary system. You're now ready to progress to Unit 22, the digestive system.